What is hidradenitis suppurativa, most commonly known as HS, and how does it affect your skin and your PMOS? Let's talk about it. Hi, I'm Dr. Kim Sommerville, your general practitioner and your clinical nutritionist, and we're going to be talking about all things HS, what causes it, how do you treat it, and how do you make sure that your skin doesn't get terribly affected. Now, HS is a chronic condition that affects your skin. Chronic meaning that it can happen for months to years, and sometimes doctors even take up to months to years to find out what's really happening. It's usually associated with inflammation, and it has blockage of the hair follicles as well as the sweat glands. So the sweat glands are usually called sebaceous glands, and what happens is that it produces something called sebum, which coats the skin to ensure that it's lubricated. However, with HS, what happens is that sebum becomes too thick, and when it's too thick, it blocks the hair follicle and it blocks the sweat gland. Of course, if you're going to have blockage, then there's going to be the thickened sebum, there's going to be skin cells that can't get out, and there's going to be bacteria that shouldn't really be there in the first place, which can now lead to infection. So what we typically notice with persons with HS is that they have boils that come and go through months to years. Those boils form deep nodules down into the skin, and then those nodules form tracts. So the inflammation doesn't just stay in one area, but spreads across the deep layer of the skin, and then they form scar tissue. Kind of difficult to treat, but it is possible. If you have HS, you might find that about 1 to 2 days before a boil starts to form, you might feel a little pain in the area, itching, burning, warmth, and more sweating in that specific area. The most common areas to find lesions of HS is mostly in your underarms. And after your underarms, you may find these in your groin, in your inner thigh, on your buttocks, around your vulva, as well as your anal region, and even on your chest or back. Now, why does HS even occur with some persons and not others? Well, specifically, research has found that persons who have HS tend to have genes either from their mother or father as to why this really even happens. Outside of genes, there has to be some amount of behavior or environments that make HS more likely to occur. If you're a woman, you're 3 times more likely to develop HS more than men. Unfair, I know, but it happens. So they're also noticed that if there's certain hormonal changes, like having a higher amount of androgens or male hormones, you tend to develop HS as well. So that is why we find that HS is more likely associated with PMOS when it comes to women. So the higher the amount of androgens is, the more thick the sebum in the sweat gland will be, and of course that's why there is blockage and the skin problems that happen thereafter. Some other reasons for HS to occur are being overweight or obese, a lot of skin friction, especially in your underarms or groin, as I said, higher amount of androgens, and even smoking as well. Women also notice that HS lesions tend to occur mostly when they're starting their period, when they're very stressed, or summertime. Excess sweating, excess heat also brings about more HS lesions. Outside of PMOS, other medical conditions that may be associated with HS are type 2 diabetes, hypertension, obesity, as I said before, and sometimes major depressive disorder. Now, of course, because of HS, there's a lot of pain that can come from it. There is possibly oozing of the lesions as well, and that can then make persons anxious, depressed, sometimes cause them to be isolated from their co-workers or their friends and family, and it can also cause sexual dysfunction. During the intercourse, there may be more pain, there may be embarrassment due to the lesions, and it can have you have less work productivity just because of all the issues that it may come with. So how do we treat HS? Can we prevent it from occurring? And if it does, how can we make sure that it heals much faster? So as a nutritionist, of course, I'm going to start by talking about the diet. As I said, the reasons why HS occur outside of genetics is our environment and the behavior. So if we can manage the inflammation and the excess androgens, then we can possibly prevent the HS lesions from occurring. So one thing we can do, especially for inflammation, is supplement or eat foods with high amounts of omega-3. Omega-3s allow these lesions to heal at a faster rate. So you can find omega-3s as a supplement. Usually you want it to be 2,000 milligrams per day that you're taking. Or you can find it in food, of course, like fish, such as sardines, mackerel, tuna, salmon, the plant-based things like chia seeds, flax seeds. These will definitely help not only have omega-3s, but the plant-based omega-3s will allow for high fiber as well. That leads me to go on to high fiber. Now, the more fiber you have is the less you're going to have insulin resistance. And for my girls with PMOS, less insulin resistance means less androgens. So, high fiber foods like oats, quinoa, broccoli, pak choy, callaloo, chia seeds and flax seeds, nuts, beans like red peas, lentils, chickpeas, black beans will help your gut health, improve your insulin sensitivity, reduce your androgens, and make you have less of the lesions of HS. Some other ways that you can manage your HS with food is by having more lean protein. And lean protein just means protein that doesn't have a lot of fat content. So that can be chicken breast, fish, as I mentioned before, beans, nuts, as well as meat. Now, red meat is a little bit tricky because the more red meat you have, even though it can be lean, is the more inflammation we see. So I would say to have about less than 3 servings of red meat for the week. And sometimes you can even cut it out to see if it does make a difference for you. I don't usually talk about reducing or cutting out things at all, but the more you can reduce your processed sugars or high saturated fat foods like fried foods and pastry may be better for you when it comes to managing the inflammation that HS is associated with. Moving on to exercise. As I said before, being overweight and obese is one of the factors that really makes HS worse. So if we're exercising, we may find that we reduce a little bit of our weight, and that can help. But exercise not only reduces weight, but it can manage stress. So some things that we can do in terms of exercise are ones that don't cause a lot of skin friction. Things like walking this way, swimming, yoga, which helps to reduce stress, as well as Pilates, can manage your stress and form a little bit of a barrier against developing more HS lesions. We know that you can be referred to a dermatologist or even an esthetician to help you manage your skin a little bit better. However, what you can also do is use topical agents on the skin. So we can use chemical exfoliants that have salicylic acid or benzoyl peroxide about probably 1 to 2 times a week in the areas that you typically get HS to allow for more of the dead skin cells to be removed and to open up those hair follicles so that all the bacteria can be removed as well. Once you're exfoliating your skin, you are removing some of the skin barrier. So you want to protect that skin barrier by putting on hydrating toners that have hyaluronic acid, ceramides, or niacinamide, or ones that protect your skin, such as moisturizing lotions. These are all the things that you can do in terms of your lifestyle, but please ensure that you speak with your doctor before starting any of this type of treatment. Most of the time, when you have a stage 1 HS, which is mainly just boils in your skin area, they typically allow for warm compression, antibiotics, as well as inflammation and pain relieving medications. Outside of antibiotics, if there's no infection present in your skin lesions, then doctors may also add anti-androgen medications, which essentially is just medications that reduces your excess androgen, which of course should prevent the HS lesions. So these can be something called spironolactone or finasteride, anything that your doctor thinks would be best for you at that time. Outside of that, they may even give you injections of steroids in the area with the HS lesions to reduce that inflammation and hopefully improve that healing process over time. If it is that you've tried these medications, tried the lifestyle changes, and nothing is really helping, and now you have gone on to stage 3 HS, where there are boils, there's tracts, there's scar tissue in the area, you may consider going to a plastic surgeon who may remove that section of skin and form a graft, which is another type of skin that is put in the area to help you just have a better quality of life. If you have HS, it can be very debilitating in many different aspects of your life, but it is possible to get better treatment and better results once you understand what is happening. Please consult with your general practitioner, your dermatologist, or your nutritionist to help you get to a much better quality of life. This is Dr. Kim Sommerville with Simple Summer Naturals, telling you to have a wonderful day, and I hope this information was helpful. Take care.